and following your markings. Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field. The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed. Now the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about. Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur to set up the distal femoral cutting jig and alignment device. The jig is put into position and helps ensure that the cuts made to the bone are exactly what are needed. Now hammer in the pins to hold the jig. We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component. Another cutting jig, along with the bone saw, allows us to finish shaping the femur. Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia. This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins. Use the bone saw to cut off the top of the tibia and prepare it for the new tibial components. Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella. Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the tri-up a batch of cement for you to use. With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away. Lay the leg flat on the table so the new knee components put pressure on each other.